Another COVID booster is one step closer to hitting the market. Today, an FDA advisory panel voted to recommend a second Johnson & Johnson shot. Members unanimously agreed that any adult who got the single-dose shot should be eligible for a booster. The decision will now go to the FDA, which is expected to make a final ruling in the coming days. Thank you for staying with us. I'm Fred Shropshire. This decision coming just a day after the FDA panel recommended a booster for the Moderna vaccine, but with more restrictions. WCNC Charlotte's Chloe Leshner live at the Mecklenburg County Health Department. Chloe, there have been a lot of moving parts this week, so what do people need to know?
Well, the biggest takeaway, Fred, is that anyone who went and got that first dose of the Johnson & Johnson vaccine will likely have to get a second dose, and that FDA panel recommended they get it at least 2 months after the first. But this is not set in stone yet. There are still several checks and balances on the system before it could get that emergency use authorization.
The ease of a single-dose shot was appealing to a lot of people when the vaccines first came out.
I had an appointment in a couple more days, but I'd rather take this one since it's sooner and it's only one shot.
The Johnson & Johnson shot has been given to some 15 million Americans 18 and older. And Friday, an FDA panel recommended they all get a second dose to boost their immunity.
We do have 19 out of 19 unanimous yes votes for this question.
But it's not just the Johnson & Johnson product. The FDA panel also recommended older adults and those vulnerable to the virus who got Moderna get another half dose. Boosters are already authorized for certain populations who received the Pfizer shots.
The people we're seeing that have been vaccinated that have post-vaccine infections have milder symptoms. The people that have post-vaccine infections that end up in the hospital are those groups, the older individuals, multiple medical problems.
No vaccine is perfect, so breakthrough cases are expected. But people who don't fall into an eligible group shouldn't be concerned. Experts insist the vaccines are doing what they're supposed to.
The third dose, as it stands right now, is really just increasing your chance of avoiding an asymptomatic or mild case. 2 doses are really giving some nice memory cells to folks. So I think we have to separate again, what are vaccines designed for? And almost all of them are really designed to prevent you from dying of that disease.
So again, a few more steps before this would become official, so that could take another week or so. But by the way, the Mecklenburg County Health Department is having a vaccine clinic here at the Billingsley Road location tomorrow from 8:30 to 4:30. They will have the Johnson & Johnson product and the Pfizer shots. They're giving those Pfizer boosters to people who are eligible. Live in Charlotte, Chloe Leshner, WCNC Charlotte.
All good information for people to know out there. Thank you, Chloe, for that report.